Throughout the past 19 months, the COVID-19 pandemic has impacted and transformed nearly every aspect of long-term care. This has led the team at the Pennsylvania Healthcare Association to ask, what will the future of senior living look like? This October, we're looking to the future of long-term care, how to radically change old habits, face new challenges head-on, and find new ways to revolutionize the care we provide. That's what the road to reinvention is all about. So get ready. The 2021 PHCA Convention and Trade Show starts right now. Good afternoon, everyone, and welcome back to the Capitol. I'm Shamberg, and I'm the President and CEO of the Pennsylvania Healthcare Association. And I'd like to welcome you to the second edition of our virtual PHCA Convention and Trade Show. And we're beginning today here at the Capitol because even today, on the first day of convention, we're advocating for you, we're advocating for our membership, and we're advocating for the future of the long-term care industry in Pennsylvania. It's been our honor to be the voice of long-term care for the past 19 months. It's been our honor to be the voice of the epicenter of the COVID-19 pandemic. And we're beginning here today at the Capitol because it's here on these steps where you've been made a real priority. Whether it's fighting for PPE, for testing, for staffing resources, for the COVID-19 vaccine, for funding, for liability protections, or even just for a seat at the table. It's here in Harrisburg where we've ensured that your voice has been heard. And the momentum that we've built, we're going to use that momentum for the next month and well into the next year. So sit back, relax, and join us on the road to reinvention. And we're back at the PHCA office in what has become a very familiar place for me. It's right here in front of this bookcase where we've recorded interviews, delivered testimony, and called for support for nursing homes, for personal care homes, and for assisted living communities throughout the state. But today, I'm delivering arguably the most important message to you. Now, you may be asking yourself, or at this time you may be asking your computer screen, I thought we were doing this convention in person. And you're exactly right. A few months ago, we announced to you that we were making our triumphant return to Kalahari Resorts and to in-person PHCA events. In fact, you just watched the opening video in which we loaded our members onto a party bus and we began to drive them up to Kalahari Resorts. But as we've learned since March 2020, circumstances, especially in long-term care, can change very, very quickly. So here we are, back in a virtual format. And at some point, we will have to let those members off the bus. But more on that a little bit later. This year, throughout the month of October, we're thrilled that you've chosen to join us on the road to reinvention. These next few weeks, really our entire convention, will be focused on preparing you for what's ahead, for our ever-changing operating environment, for the continual wave of regulatory and legislative proposals that focus entirely on our industry, for all the updates and the adaptations that we know we need to make moving forward. Because if we've learned anything throughout the past year and a half, it's that we must adapt, we must be agile, and we must remain at the forefront of change. Speaking of change, we've learned a great deal since coming to you live for last year's virtual PHCA convention. And I think it's safe to say that this year we've perfected the virtual format. First, no Band-Aid this year. And if you joined us last year, I'm sure you remember that. So right there, we're off to a great start. Second, our sound sounds great. And third, with the help of our friends at Cap Collective, we're coming to you with a clearer picture than ever before. And we're excited that we can share this experience with you. So let me tell you what we have planned throughout the next few weeks at our convention. First, we wanted to make sure that the Road to Reinvention could be your go-to resource for education. No matter what was happening in your facilities or in your communities, we knew that you still needed your CEUs. But we also knew that what you do every day wouldn't necessarily enable you to stick with us for 3 or 4 straight days of live virtual sessions. So to accommodate your schedule, we made all of our learning opportunities, including this one, on demand. Just think of us as the Comcast Xfinity of the long-term care world, but with much better service. I hope they're not a sponsor of ours. So whether it's 3 p.m. and you have a break in your day, or it's 3 a.m. and you just can't get to sleep, you're going to be able to earn CEUs by accessing our on-demand sessions and watching them on your schedule. It's pretty convenient, huh? And the quality of this year's convention content is unlike anything that we've presented before. Of course, we have sessions geared towards our nurses and skilled nursing operators. We've got sessions specifically for assisted living and for personal care. But we're not just looking at operational issues this year. We've got a legislative update with a focus on what's happened and what's happening in both Harrisburg and Washington, D.C., from 3 of the brightest political minds in long-term care today. We've got a special session on diversity and focusing on promoting diversity in our facilities. And once again, we have many sessions focused squarely on leadership. How to find it, how to teach it, and how to create leaders in your organization. And if you still can't find something that you're interested in, then we will send you a full refund. No, we can't do that. Okay. If you still can't find anything, then just let us know. Because the beauty of a virtual convention, besides having the ability to earn CEUs in your office or on the couch, is that you may see new sessions popping up on our schedule throughout the next few weeks. And that's based entirely on brand new issues that are happening across Pennsylvania. We can be flexible. Again, we can adapt. And we can make this the best educational experience that you've ever had with PHCA. Now, those on-demand sessions, they're great. And starting right after this session ends, they'll be ready and waiting for you. But don't forget about our weekly keynote sessions. You're watching me now, and for the next 2 Tuesdays at noon, we'll be launching very special keynote addresses from 2 very special speakers. Next Tuesday at noon, I hope you'll join me in watching our keynote address from Dr. Brian Williams, an international speaker and author who focuses on service excellence and leadership effectiveness. He's got a very simple mission: to serve others so they may better serve the world. In Dr. Williams' session, you'll learn about key approaches to service that all world-class employees have, with a special focus on what's called the 6 habits of service superstars. You are going to leave that session with practical and real-world takeaways that you can use immediately. And we can't wait for that. And the following Tuesday at noon, that's October 19th, you'll learn what engages hearts, heads, and hands in serving your residents better than anyone in your competition. You'll learn what inspires teams to be their best and to continue to excel through various seasons, not just this one. Elizabeth Dixon, she's a speaker, a writer, a strategist, and an entrepreneur, will walk you through the benefits of defining and implementing purpose in your organizations, in your teams, and really how to do it. Now, for those who attended our virtual ALPC Summit earlier this year, you'll recall that Elizabeth Dixon was our keynote speaker then, and she was so good, and the demand to see her again was so high, we asked her to come back and join us this month during our convention. Now, I don't think we'd stop there with just education, because as anyone who has joined us for a convention can tell you, there's more to this event than just earning your CEUs. Starting tomorrow and occurring for the next 2 Wednesdays at 12 noon, we'll be pulling back the curtain for a very special virtual conversation, which we're calling PHCA Ask Us Anything. For 30 minutes each Wednesday, I'll be joined by my colleagues here at PHCA to host a special question and answer session on any topic that is important to you, your colleagues, or your communities. Want to discuss talking to the media or expanding your social media capabilities? We can help you. Having regulatory challenges that we can help address? Then join us. Want to get legislation moving on an issue that hasn't yet been tackled here in PA? We want to hear your idea and then pass it off as our own. Looking to lose 20 to 30 pounds so that you can be beach ready by next spring? Yeah, I probably can't help you with that. But for almost every other question, we'll be here each Wednesday at 12 noon to talk to you and hear what's happening on the front lines. Additionally, for those regulatory questions and updates that continue to be raised as we attempt to navigate the COVID-19 pandemic, we're going to be holding special office hours to get you the answers you need and to give you even more insight with special guests and special speakers. Each and every Thursday during convention at 12 noon, we hope you'll join the best regulatory team in the entire state to hear about updates pertaining to nursing homes, to personal care homes, and to assisted living communities. We'll answer your questions, we'll provide important information, and we'll be bringing subject matter experts into the mix to share both their insights and their advice. And finally, on Tuesday, October 26th, we'll bring you updates from the Department of Health and Department of Human Services live. You'll have the opportunity to ask questions and participate in a very important discussion with our state leaders, and we hope you'll join us for that as well. Now, aside from our educational sessions, we've also got our business partners and our virtual resource centers, where you can check out what our partners are offering and all the services that they're providing. Every day, all day, our exhibit hall will be live, and you'll be able to virtually visit a booth or that virtual resource center and set up a time to chat with an expert on how your facility, your community, or really your company can improve. As always, what you're seeing today and what you will see for the next few weeks would not be possible without the support and help from our business partners. And finally, don't forget to download our Handbid app and take part in our silent auction. It just went live, and it is officially open right now. We've got gift cards, we've got sports memorabilia, terrific prizes, and all proceeds go to benefit the PHCA PAC, our Political Action Committee. Last year, I personally bid on thousands of dollars worth of those gift cards and memorabilia. And after being visited by 2 gentlemen set to collect payment many weeks later, I gladly contributed to the PHCA PAC. And I hope that you will too this year. So that's our look ahead at the next few weeks. Additionally, the PHCA bylaws call for an annual meeting to be held each year during our convention. This year, there is no new business to bring before our membership. So unless someone wishes to raise an issue, we will officially conclude this year's annual meeting. Now, I want to be very clear. The road to reinvention, for all that's happening and all that we're offering this month, has been paved and created for you. The road to reinvention is about improving the climate in which you operate. It's about giving you the tools you need to succeed. It's about teaching you something new, whether that's focused on the ongoing pandemic or on other aspects of caring for your residents. PHCA at its core is a member-driven organization. We exist for one reason: to serve you. And that's been our driving force since March 2020, and we've never lost sight of it. I'm going to begin just as I did last year, and just as I do in any forum like this, by saying something that these days isn't said enough. You may have heard it in March or April 2020, but more than likely, you probably don't hear it much anymore. But it needs to be said, and you deserve to hear it. Thank you. From every one of us here at PHCA, thank you for everything that you've done throughout these past 19 months and throughout the entire COVID-19 pandemic. Thank you for sacrificing everything to protect our most vulnerable residents. Thank you for putting your safety second to someone else's. And thank you for sticking with long-term care, even as we've seen others who have left our industry. You're heroes. You are our healthcare heroes. You have lived up to that special designation, and no one can ever take that from you, even though many have tried. Representing you and what you do every day in Harrisburg and throughout the entire state has been the honor of a lifetime for me and for the members of our team. I have been proud to lead this association throughout the last 19 months. We have become stronger, louder, and a force to be reckoned with in the halls of the Capitol. I have been proud to work with the members of our PHCA board, our board's executive committee, our ALPC board, our various committees, all of whom help steer the direction of this organization. And I also feel very privileged to lead a team of hardworking and committed staff who know they work for you, our members. And I will be forever grateful to have spent the last year alongside an incredible leader, a passionate executive, and one of the great board chairs this association has ever known. And that's Karen McCormick from Wilmac. I want to personally thank Karen for her dedication to her role as our PHCA board chair. It has truly been an honor to serve alongside Karen and watch her advocate for the industry she loves. I also want to thank Megan Campbell, our ALPC board chair, who has been a fantastic leader for assisted living and for personal care. Along with Kevin Sizik, our director of assisted living and personal care, Megan has ensured that our association stands for the entire continuum and that every provider has an equal voice. Thank you, Megan, for your advocacy, for your leadership, and for fighting for your staff and for your residents. And it's that fight that I really want to talk about here today. Because these past 19 months have been a real fight, haven't they? Take a moment to just think back and reflect on 2021 thus far. The year began in January when the COVID-19 vaccine was being distributed to nursing homes all throughout the country. But in Pennsylvania, we had to wait for hospitals to go first. It continued in March, in April, May, and June, when the dust was settling from the height of the winter surge and case counts were dwindling in our facilities. But our workforce crisis began to reach a level, a fever pitch, that we've never seen before. To July, when our state's Department of Health issued a regulatory proposal that would have far-reaching implications on how we staff and how we sustain as an industry moving forward. To August, as vaccine mandates made headlines and potential threats and punishments were levied on nursing home providers and no one else, while our workforce shortage continued. To today, as we launch our virtual convention rather than an in-person event because the COVID-19 Delta variant has swept across our state, resulting in rising case counts and higher community spread in every single county in Pennsylvania. Wasn't it supposed to be better this year? Weren't things supposed to be easier in 2021? As I've learned, things are never easy in our sector. They weren't before COVID-19 was discovered in a Seattle nursing home, and they won't be long after this pandemic is over. But that's what makes us so resilient and so strong. And it's why we're so proud to fight alongside you. Today, I'm supposed to address the state of our association, and I'm supposed to talk to you about membership and solvency and our outlook moving forward. But I'm not going to do that, because the real measure of an association and of a membership, of an industry, is its ability to step up and to fight and to successfully advocate for what's right. And that's exactly what this year has been all about. When I began last year's address at convention, I told you about the birth of Vivian, our first daughter, late last January. Vivian spent the first year of her life at home with mom and dad, subject to COVID-19 restrictions and lockdowns. She still hasn't been in a restaurant. She has yet to go shopping with us, which is actually probably a good thing. And she won't get to see Kalahari this year or ride the water slide with her dad because of those rising case counts throughout the state. And in just 1 month, we're going to be welcoming our second daughter to our growing family. And if there's one thing I've learned as a father, it's that everything you do is ultimately about making your children proud. It's about coming home after a brutal day and knowing that everything you did it for them. And I'm determined that in the year ahead, I'll be able to tell Vivian and her sister that we collectively made a real difference in Pennsylvania, throughout the entire country, and in the world of long-term care. How? By securing meaningful investments year after year after year in the funding that you receive. By reforming our regulatory system so that it's collaborative rather than punitive. By finally resolving Pennsylvania's flawed legal system so that it's our industry that thrives, rather than the plaintiff attorneys who file lawsuits against us day after day. By truly addressing our workforce crisis and rebuilding our workforce pipeline so that we can continue to provide care. That's going to take many, many steps. But I believe we've taken some critical steps already. First, when I think back on 2021, I'm going to think of 4 simple words. 4 simple words that created a movement, a call to action, and an urgency in the halls of our state capitol. Fund the front lines. On the strength of those 4 words, lawmakers in every corner of this state, as well as our governor, Tom Wolf, chose to prioritize long-term care. Just think back to June of this year. With every single industry in Pennsylvania crying out for help, for aid, for support, your voice rose above the rest. Our legislature and our governor made a historic investment in you. $247 million for nursing homes, $30 million for assisted living and personal care, $16 million for the Medicaid Day One incentive payment, which will go to facilities throughout the state who care for the majority of our Medicaid residents, $5 million for a brand new grant program focused on improvements to HVAC systems in our facilities and in our communities. In all, $315 million for the epicenter of the COVID-19 pandemic. That speaks to the work you've done and the very clear message that you've sent. Earlier this year, we continued our PHCA tradition of holding vital conference calls with members of the state legislature. And just as we did during 2020, we brought your message right to our state representatives and our state senators. We told them how dire the situation was, and we asked them for their support. Ultimately, we asked lawmakers to fund the front lines, and that's exactly what they did. At the same time, we were the only state association in the entire country conducting a congressional briefing event for our members. While we advocated here in Harrisburg, we asked you to join us virtually in the halls of the U.S. Capitol to meet with Pennsylvania's congressional delegation and our 2 U.S. senators. It was on the strength of those meetings that we've seen real movement now with the Federal Provider Relief Fund, with long-term care being inserted into the conversation surrounding the next federal stimulus package. And it's because of your advocacy and your passion for what you do every day. Just days after the state budget passed in June, we saw PHCA-supported state legislation sponsored by Senator Lisa Boscola become law. This important initiative, which will compel Pennsylvania to enter the Nurse Licensure Compact, or NLC, will also allow you to recruit workers and frontline caregivers from out of state, from our neighbors who are also members of the compact. And it won't take weeks and months of regulatory hoops and hurdles to get them started anymore. And that happened because you spoke up and you demanded action. Through it all, in the halls of the Capitol and from the comfort of this office, we testified. We told your story. We refused to slow down after the momentum was built last year. In fact, we kept our foot on the gas pedal. Once again, I am proud to tell you that PHCA is the voice of long-term care in Pennsylvania. During legislative hearings before the House and the Senate, on television, in newspapers, on the radio, online, hundreds of interviews, stories, articles, and television spots have helped us arrive at this point. When Pennsylvania thinks of long-term care, they think of you and they think of PHCA. And that's because we knew we needed to be heard. So we've had success this year. We've achieved victories. We've made strides against a global pandemic. But that doesn't mean our fight is over. In fact, I'm here to tell you that we think it's just beginning. Last year, I told you that we fought with every ounce of our collective effort for collaboration with state government, just for a seat at the table. And we fought against an administration and any elected official who refuses to put you first in their relief effort, or who refuses to acknowledge that you are the men and women on the front lines. And I'm proud to tell you that that fight continues today. In mid-July, our state's Department of Health issued its first set of updates to the nursing home regulations. And we know what they started with: 4.1 staffing. In the midst of a pandemic, in the midst of the greatest workforce shortage this industry has ever known, this proposal was issued. We said it then, and I'll say it again today. It's unfounded, it's unfunded, it is unattainable, and it is grossly out of touch with the reality every single one of our providers faces each and every day in Pennsylvania. So we fought back, and so did you. Hundreds of comment letters were submitted, emails, phone calls, and just a few weeks ago, we appeared before 2 state Senate committees and shared arguably the most frightening statistic to emerge from the past few months. Providers throughout Pennsylvania, including our members, are now closing their doors to new admissions, to new residents, and new vulnerable seniors who desperately need care. If this regulatory proposal is enacted, whether it's tomorrow or next year, that alarming trend will be amplified and accelerated. And we cannot afford to allow that to happen in one of the oldest states in terms of population in the entire country. It wasn't long after the 4.1 staffing announcement that we began to also hear about vaccine mandates. First in Philadelphia for all healthcare workers, then from the Department of Health for nursing home workers only. That vaccination target was set at 80%. But it was in mid-August when the real announcement was made. President Biden called for 100% vaccination rates in nursing homes, every staff member, every frontline caregiver. And if that rate is not achieved, providers risk the very state and federal funding that they rely on to continue caring for residents and supporting their employees. Just moments after that announcement, PHCA was the only state association to call on the president and to call on all elected leaders to stop with the threats and the punishments and to collaborate with those healthcare heroes on the front lines. Because we support our members in the decisions they make to mandate or to make the vaccine a choice. But what we don't support and what we'll never support is taking that decision away from you and threatening to cripple an industry that is already on the brink. So it's safe to say we've kept up our fight this year, but that doesn't mean our work is done. In the weeks and months ahead, we will continue to focus on the workforce shortage, the workforce crisis in long-term care, and we'll work to find real solutions for you. We'll focus on achieving meaningful, recurring investments in your funding. And as the 2022 elections approach, in which Pennsylvania will elect a new governor and a new U.S. Senator, we will make certain that long-term care is the election issue that every candidate will need to address. Just as I said last year, I've never been more proud than I am today to sit before you as the leader of the strongest association here in Harrisburg. And I didn't say strongest long-term care association. I said the strongest association in this state. And that has certainly held true this year. Why? Because when we speak on your behalf and when you speak, people listen. We've known it all along. The past 19 months has given long-term care a voice, a bullhorn, a reason to shout from the rooftops and plead for support from our elected officials in Harrisburg and in Washington, D.C. And for the first time, maybe ever, we have the microphone, even today. And I want to keep that microphone with you now. In years past, we would celebrate at each and every convention with our PHCA Hero Awards, a collection of honors that's bestowed upon our Administrator of the Year, our Executive Director of the Year, and others. But given the challenges we've faced throughout 2021, how could we possibly choose just 7 honorees? Our members are all heroes, and this video is dedicated to you. If the past 19 months have taught us anything, it's that heroes don't wear capes. Our heroes, our long-term care heroes, wear scrubs. They don't don armor, they don PPE. Long before the first case of COVID-19 was confirmed in Pennsylvania, you've been there, providing compassionate care to thousands of seniors in Pennsylvania's long-term care communities. And since the very beginning of the pandemic, long-term care workers across the Commonwealth have exemplified what it means to be extraordinary. You have worked tirelessly on the front lines, arriving every day, working extra hours, even isolating yourselves from your families and from your loved ones. Months of battling on the front lines, putting those you care for first. Who else can say that? Now, we need you more than ever. As COVID-19 case counts rise throughout Pennsylvania and throughout the country, the emergence of the Delta variant has caused a troubling number of breakthrough cases in our communities. Now is not the time to back down. It's time to rise up once again and be strong for those who rely on us, to be what the world needs us to be, heroes.
It has been difficult. There's been days where you honestly question if this is still where you want to be. There were days that it took my team to pick me up.
It's been challenging, but that's what we like about our jobs, that it's not boring, that there's a different, something that you've got to do each day that's different. It doesn't become cookie cutter.
The activities completely changed because residents were all isolated in their rooms. So my team had to come up with ideas to be able to continue to engage them. And so we would make event packages, and we would go room to room with ice cream truck, and we would go room to room with a happy hour cart so they could have a glass of wine and unwind with everyone at the end of the day. And it just helped the residents to know that there was still somebody available to them, even if they weren't able to come out and engage with each other.
The staff that provide care to the residents, that's the skill part, but there's a personal connection that comes with that from everyone. Every single interaction is important, and when their families couldn't be here to provide that loving bond, we stepped in. And we were there to help keep that connection strong.
I feel for those residents who don't have constant care with family members, so I have to provide that care. I have to listen to their stories. I have to spend time with them, even if it's brushing their hair, doing a puzzle, reading a book with them, just talking to them. I feel like I have to do that because some of them don't have those family members who can come in.
I know grandkids, I know former pets, I know flowers that they like, certain meals that they love to cook, old boyfriends, school dances, just stuff like that you wouldn't just, because they'll tell you anything if you just have to take the time to sit and ask, and we've had that.
I feel the residents without us would be experiencing a lot more depression and illnesses that come from depression. And I feel that we're real with them. We laugh, we sit and we talk and we tell jokes, and we not only provide the care that we're to provide, but we're real people and we bring the community into them too.
It takes a huge heart, but it takes a lot of resources that aren't always there. So we appreciated all of the contact from PHCA, and when we didn't know what was going on, PHCA was there to help us, but I think just nationally, there's so much more that could be done to help.
We need legislative support. I can't lie. It's very frustrating to see the staffing challenges across the industry. There are people that want to work in this industry. They want to care for others. They get as much back from it as they're giving in, and some of them even more. There are people who outside of work have so much turmoil in their personal life, and they come here and they have purpose.
We care so much about the people that we take care of, and that we appreciate them and their families and what they're going through and some of the struggles they may be having or have had in the past, and that we're here for them, and we're just here to make their life as easy as we possibly can and as fun as we possibly can.
They were heroes. Our healthcare workers were heroes, and that is so true. They went outside of their comfort zones. They were doing jobs that they wouldn't typically do.
I can plunge a toilet, or I can put on a big show. I can help with the housekeeper and emptying trash. I can deliver a meal to a resident. Knowing that everybody's willing to put those hats on to do whatever's necessary is what makes us who we are.
I feel proud that those that are here give their all. They really do. They give their all, and I'm really proud to be part of that industry.
As we look down the road, we know long-term care will never be the same. But we will work together to usher in a new era, a new beginning, today and in the years to come. On behalf of the entire team at the Pennsylvania Healthcare Association, we thank you for your dedication, for your unwavering spirit, and for your commitment to providing compassionate care to our most vulnerable residents. let me go back to my family, because any proud father wants to keep going back again and again to that subject. As I started, I want my daughters to know that their dad is a fighter, a strong advocate, a leader for long-term care. And earlier this year, that strength, our strength in Harrisburg, was cemented with the release of the Healthcare Power 100, a list of the most influential healthcare advocates in Pennsylvania's political circles. And at number 20, after the hospital system CEOs and the various department secretaries, stood PHCA, the highest ranking for any association or any advocacy organization. That announcement truly announced that we had arrived and that we were here to stay. Now, I purchased a copy of that magazine, which contained our ranking and our photos. And earlier this year, on a hot July day after work, I handed it to my daughter and I showed her the PHCA page. And she pointed. "Daddy," she said, "good job." Now, she hasn't said good job since, and I probably will never ever hear her say that again. But in that moment, I knew that we had done some good. But once again, our work is not done. The road to reinvention officially begins now. And we're thinking about what the next few months and the next few years will look like for you. What will the future hold? What will it hold for our members? What will it hold for long-term care in Pennsylvania? What will change? In a word, everything. Everything will change. And it may be impossible to gauge what the future of long-term care looks like. But I know what the future of PHCA looks like. We'll change. We'll adapt. We will get stronger with you. We will be proactive, not just reactive, in creating policy. We will lead both statewide and nationally. We will be looked to for our ideas and for our vision. And soon, number 20 won't be good enough. Again, to everyone watching today, thank you for your continued effort. Know that we have gone to battle with you, and we will continue to fight alongside you and for you every single day. We'll fight for your residents. We'll fight for your staff members. We'll fight for everything you need to beat COVID-19. And here in Harrisburg, we'll make you proud. Thank you very much.